What's going on, guys, and welcome back to the channel. This is Student Physical Therapist on Rumble slash Sustained Warfare, which is a new project I've been working on. I will drop the links in the description below to the Instagram page that I'm trying to get going and the Patreon if you feel so moved. Please don't forget to like and subscribe. It helps a lot here on Rumble as well as wherever else you may be watching this. So what we have today is a Special Warfare community member who had patellofemoral pain, and they reached out to me because I know some people that are pretty cool, and they said, hey, I'm having some issues with my knee pain. And this is the result of me talking to them and working with them over the course of a couple weeks. So let's dive right into it. So what is patellofemoral pain according to Physiopedia? Patellofemoral pain syndrome is an umbrella term used for pain arising from the patellofemoral joint or adjacent soft tissues. It's a chronic condition that tends to worsen with activities such as squatting, sitting, climbing stairs, and running, which is exactly what you will see here later. Historically, it's been referred to as anterior knee pain, but this is misleading as the pain can be felt in many parts of the knee, including parts that you don't know and you don't need to know right now. Basically, that means behind the knee right there. Symptoms can develop slowly over time or are brought on acutely. It tends to reoccur after 2 years in about 40% of cases. So this is where we have to get into a little bit of anatomy for the knee joint. So you can see where the gold and purple arrows are. There's a lot of words around there. There's a lot of text to describe the different ligaments, to include, I think it has ACL in there, it has PCL in there, it's got your lateral collateral ligaments. It might even point out, yep, it does point out the medial collateral ligaments. That's not where I really want to look right now because those you would know if those were hurting you. Where I want to look at right now is where the gold and purple arrows are. So there's the quadriceps tendon and there's the patellar tendon. Quadriceps tendon is coming down from the quads into the kneecap or the patella, and then from the patella down to your tibia, you have the patellar tendon. Those are the two ligaments I think almost everybody tends to have pain in when we think of pain or patellofemoral pain syndrome. And now if you look to the red arrow, that's a little bit more what it looks like when you're thinking of actual anatomy. Like if you were to peel the skin off of a cadaver and look, that's much more what you're looking at. You can see how all those tendons kind of wrap together over the patella, through the patella, and then down and attach. And that tends to be where like 90% of people are having pain, is that general area. So keep this in mind in terms of, your tendons and ligaments when you're feeling that knee pain. So when you feel it above the kneecap or below the kneecap, you have an idea of where that pain is. So that way you can more appropriately talk to medical professionals when you go into your doctor, your medic, whoever. You can say, hey, yeah, this is definitely my quads tendon. It's right here. I know it for a fact. This is where it hurts. But we also can't rule out pain referring from other areas. So you can see here, rectus femoris, which is one of your quad muscles. Where does it radiate to? Your kneecap. Vastus medialis, which is one of the big muscles in the inside of your thigh. Where does it radiate to? The kneecap. Where does vastus intermedius radiate to? Well, not quite the kneecap, but it radiates a lot around your thigh up there. And you can also have vastus lateralis, which usually goes to the goes behind the knee and kind of falls almost an IT band pattern. So there's lots of different muscles that if you're actually having issues with, trigger points with, weakness, partial tears, strains, whatever, it can refer and feel like it's in the kneecap. But what's important to take away from this slide is your knee is stuck in the middle with nowhere to go. If you have issues with your quads, issues with your hamstrings, issue with your hips, your glute med, for example, which is really common. Men do not really strengthen their hips enough, specifically soldiers. It's kind of concerning. When you have those issues, your knee is stuck between your ankle and your hip. It doesn't have anywhere to go. So if you have issues above the knee and below the knee, it usually manifests at the knee, unfortunately for us. So even though you may be having knee pain and think it's patellofemoral pain, it might be muscular in nature. Something to keep in mind. So let's get to our patient. The patient that we had is a 25-year-old male who had a 9-month history of knee pain, specifically in the anterior knee. The pain limits him with running, weightlifting, particularly anything with the lower extremities. That's what LE stands for. Stair climbing, rucking, swimming. He said anything that involves him bending his knee hurts, and he's limited in. Sound familiar from the earlier segment we were reading? The patient has seen his doctor. He's seen a physical therapist. He's received acetaminophen 800 milligrams. Surprise to anybody who's in the military. It's not a surprise. They tell you that fixes everything. And the patient states they have been doing stretches and mobility exercises to reduce pain for at least 6 months and they have no effect. So basically, what I'm getting here is I hurt my knee. It's slowly been getting worse until it's now agonizing. I can't walk up a flight of stairs if I wanted to without having to take a break. I can't squat. I haven't been able to squat with weight for months. And everything I've tried, to include looking up yoga flows, looking up your mobility exercises, trying to do like weird strengthening routines to go in there and help my knee. None of this has helped. I'm at my wit's end. What do I do? Why does my knee hurt? Is kind of the attitude the individual had. So if that is you, fantastic. You found something, you found a video that's probably going to be able to help you. So let's take a look at the next slide. The treatment is actually really simple. So you're going to do what's called knee mobilizations. You can look these up on YouTube. I'll probably record a video of them later and put them in the description. But effectively what you're doing is the kneecap has become what we call hypomobile. It's not moving the way it's supposed to. And this is generally because it's stuck between the tension of the tendons. So inferior glide is where you would have your hand cupped over top of your kneecap while your leg is straight and relaxed, and you gently kind of oscillate it down towards your toes. Superior would be bringing it up towards your hip. Tilts are where you would literally have your hands on either side of the kneecap and you gently tilt it up one side and up the other. You'll notice there's no horizontal motion listed here. There's no interest in bringing your knee to the outside or to the inside because that's how you dislocate it. That's how you have issues. So again, this is educational. This is a case study. This is what I showed someone else to do. Don't ever try and push your kneecap to the outside or to the inside. That's not what we're interested in here. What's typically happening with your knee, if you're not able to do these motions, is it's not moving well up and down. It's not really having a hard time moving side to side. Again, it's better to find a physical therapist or athletic trainer that knows these things, that can do these things for you. But I know y'all in the military, because I was in the military, you're going to go find some YouTube video that shows you how to do it, and you're probably going to try it on yourself. Just talk to your doc, talk to your PT, talk to a medic. Get yourself squared away. Do not dislocate your knee and make things worse. Now the exercises. Straight leg raises. That's where you're lying on your back. You have a knee bent, and you're going to take the other leg nice and straight, and you're going to bring it up to about 45 degrees or parallel with that other thigh that's bent, and then bring it back down in a very controlled manner while keeping your quads engaged the whole time. Again, I'll probably post a video on this later. The purpose of that is, again, after you've done the knee mobilizations, or after the patient did the knee mobilizations rather, now you're starting to go in there and reteach the body this range of motion is okay. I need the kneecap to be in this area. I've gone in, I've taken it from being hypomobile to making it normally mobile, and now when my muscles activate, it's not going to hurt the patella by grinding it against the tibia and the femur underneath the kneecap, and it's not going to try and pull it in a certain way that makes it painful. Or getting proper movement and proper angle of the patella between the femur and the tibia. The other exercises are, again, criminally and critically underlooked is hip abduction. We're talking about hip hikes. Okay, we're talking about banded sidestepping. We're talking about anything that involves you moving your knees apart and bringing them back together. I cannot stress this enough. If you do not do hip exercises, hip strengthening exercises, and you are in the military or you're a veteran or you're just watching this video, it's critically important that you strengthen your hips. 90% of patients that I have coming in and I'm seeing as a student, with any sort of lower extremity issues are because they do not strengthen their hips. And if you don't have a firm foundation, everything is messed up. Like I keep saying, the knee is in between the hip and the ankle and has nowhere to go. And 90% of the time, from what I've seen, it's been hip issues that are being referred down to the knee, specifically weakness. So I would say do hip hiking, maybe do a little bit of banded resistance, but don't push yourself to do the craziest exercise you can think of first or the most strengthening exercise you can think of first. Start with the basics, do the easy ones, do the hip hiking, do hip bridges. You can look these up again on Rumble. You can look these up on YouTube. There's probably a ton of them on Instagram. I'll record some. Look at those because that is generally everyone's issue. And then finally, I typed in eccentric knee flexion. And basically what that means is like if you're doing a reverse squat, for example, all that weight is on the front leg. And the quads are controlling your knees slowly bending. Another thing you can do is you can be at the quad machine, kick your legs out nice and straight, hold them out straight for about 45 seconds, and then slowly pull them in and let the weight work on them. What that's doing is while your muscle fibers are lengthening, there's weight going through them and you're strengthening. Eccentric is actually the fastest way to hypertrophy, to grow a lot of muscle. This is more interested in strengthening those quads and reobtaining a good angle between the quads to the tibia, the femur to the tibia of where your femur is, and strengthening those muscles because you saw those referral patterns earlier. If the quads are weak, no wonder why you're having knee pain. It's affecting the physics of your patella moving at the knee joint. So, again, I would look at eccentric knee flexion, which just means controlling your knees bending with your quads. Lunges are a great way to do that. And eccentric movements at the quad machine, if you have one at the gym, are great for this too. You don't want a massive amount of weight. You want a low amount of weight that you can tolerate for about 45 seconds while you slowly bring you slowly bend your knees. So what was the result? The result was that after 3 days of knee mobilizations, and these exercises, which I allowed him to choose. I gave him a list and he said, okay, I'm going to go do it. Pain-free within 3 days. Was able to squat 225 pounds first sets for the first time in over 6 months. He had no pain with stairs, but he still had slight pain with rucking and running. And I think that just goes to show how immobile many people's knees become. Just going in and reintroducing some mobility and a little bit of I guess you could say physics at the knee, right? More kinesiology and physics and stuff. The patient was able to improve enough that they were able to return to squatting and weightlifting with the lower extremities. Able to walk up and down stairs with no pain. I think we were at like a scale of like 8 out of 10 walking upstairs, and that was gone within 4 days. It helps to be young. It helps to be 25 years old. But he was at his wit's end, and it was really cool to see these improvements. And so slight pain with running and rucking, but nowhere near as bad as it was. So in theory, continue with these exercises, now focusing more on endurance and running and his form with that, which I would have to see. He's currently not in the area where I can see him, would improve these things as well. So again, if this sounds like you, that you're having these issues, you can see how this case study benefited this person. And you can see it wasn't a magic pill. He wasn't suddenly better. He wasn't suddenly able to run and ruck pain-free, which I think are the most demanding things you could probably ask him to do. But he was able to pain-free squat, and stairs were no longer an issue, and he was on the road to recovery. And I've talked to him since then, and things have continued to improve. And side note, don't do what he did. Don't be one of those people that said, okay, I hurt my leg, so now I'm going to overwork my upper body and then hurt my shoulder and then come back and talk to you in 2 months after you've recorded this video because, hey, I need some help. Don't do that. Take it easy on yourself. Don't have the mindset of, I'm going to go and overwork the things that do work. Maybe take it easy for a little bit. So what are the takeaways? The takeaways here is the knee is stuck in the middle with nowhere to go. If you have immobility in the hip, you have immobility in the ankle, probably going to feel it in the knee. Same thing with weakness. You got weakness above, weakness below. It's stuck in the middle. It really only does a few motions. It bends and it does a little tiny bit of rotation. It doesn't do as much as the hip, and it definitely doesn't do as much as the ankle. So keep that in mind. Strengthening your hips is important. And mobility is criminally and critically underutilized in the armed forces. I remember when I was in, no one cared if you had tight hip flexors. Mobility day, forget about it. We're doing push-ups, we're doing sit-ups. Here's a log. I need 8 of you to do sit-ups with it together. It's the cool bro stuff for sure, but mobility, mobility, mobility. Go in there and start doing it. I know you, and you know you, and I know that you know you, and we know that you aren't going to do mobility until you're hurt, and that's fine. But I'm telling you, start doing it now if you don't want to end up hurt. And I'm going to be doing flows here, what I call mobility flows for rucking, plate carriers, neck mobility, and the like. That way I can try and give you guys something to do to preserve range of motion and to prevent injury. So keep an eye out for those. Please don't forget to like, follow, subscribe. I'm doing this as a passion project for y'all. I'll put my Patreon in there if you really feel like helping out, because these videos take time. These thoughts take time. Putting it down. I could be doing 1,000 other things, but again, this is my passion project for y'all. So if you find it beneficial and you like it and you help, it would mean the world and it would help other people. So thank you for watching. It means a lot. I hope to catch y'all in the next video. Stay healthy and remember, mobility.